Morning, Dr. Richard Buckley and team. This morning's project is reduction of gynecomastia, so male gynecomastia. It's very common, can be caused from a lot of different things, can be genetic, can be due to some weight gain, can be due to some hormones, can be due to hormones as a function of having taken bodybuilding supplements. Those are probably the common things. And there are typically two components to the gynecomastia. One is some fat, and that would be this part that's sort of around the breast mound. The other one would be what's in the center area, and that is glandular tissue. You can very often squeeze it and feel that there's something sort of firm in the center underneath the nipple areolar complex. That's the gland. Fat we can simply suck out. We can laser and suck out. We can vaser, which is with sound energy, ultrasound energy. So the fat is sort of not the issue, I would say. We can get that nice and sculpted. The issue is if we don't take out the gland, which is very firm, gristle-like substance, then the outer part is all nicely sculpted and flattened out, and then the protrusion in the center remains. So very often, a good percentage of the time, probably most of the time, we need to get that gland out. Nice way to do that is to make a little scalloped incision kind of along the bottom of the pigmented part of the nipple areolar complex, and I can go in through that, which I will do in a little while, and I can fetch the gland out. Sometimes you get the gland out all in one piece, a big huge chunk. Sometimes there's a smaller chunk. If it's really big, sometimes I morselize it, which means I can take it out in multiple pieces. But in any case, no gland has ever beat us. We always get the glands out. Now, the fact that the gland has been there for some period of time, often for long periods of time, although we also see very young patients with gynecomastia, that gland can be pushing on the other tissues and sort of denting them in. And after we take it out, then there's an area in the central portion which is not as full as the surrounding areas. So I always do put tissues together and bring that together, which actually helps to give a little bit of a lifting effect. Sometimes there's a lot of skin laxity. What do you do with laxity? With that sort of internal bra, you could say, or internal lifting, which we do what we can with at the time that the gland has been removed. And with the vaser or laser, today we're going to use vaser, there will be some skin retraction over time. So we talked about today doing our gentleman's gynecomastia reduction. We're going to take out the glands. We're going to remove the appropriate amount of fat so things are blending in with the rest of his chest. And I'm going to tighten some things up underneath the skin. Sound like a good project for this morning? I think so. We're going to use a power-assisted lipo gadget to suck out fat. It's known as a PAL. And in here, I have my vaser gadget. And I make a little poke here, which I did, and I'm going to go in through that little poke and blast off the fat cells. And then I'm going to go through this tiny little incision, which you can probably see right here. Our little numbing stuff is kind of oozing out a little bit of my squeeze. And I'm going to go through there and get the gland out. Simple as that. And then we have the other side too. All right? Thank you for watching. Milford, MD.